young people donating blood? Do young people understand the importance of donating blood? And can one donate blood after receiving the COVID-19 vaccine? Hello and welcome. I'm your host, Dr. Musam Tomeni. Signing with us today is Trifosa Ntswelengwe. June is National Blood Donor Month, and World Blood Donor Day is commemorated annually on the 14th of June in a global celebration of millions of people throughout the world who give their blood on a voluntary, unpaid basis to save the lives of those in need. Now, the day aims to raise awareness of the need for safe blood, to thank and honor those blood donors who make transfusions possible, and to encourage regular blood donation by suitable donors. The slogan for this year is "Give blood and keep the world beating." It's a slogan that highlights the essential contribution that blood donors make to keep the world pulsating. That is by obviously saving lives and improving others' health. On Vital Signs, we'll focus on youth and blood donation. And coming up on the program, producer Zama Buthelezi spoke to a young man who received an organ as well as a blood after a life-threatening illness, as well as religious and blood donors and young people from Soweto about their views on donating blood. We'll speak to a doctor who is the lead consultant at donor services at the South African National Blood Services about the importance and the benefits of donating blood, especially as a young person. Remember that you can get in touch with us in a number of ways. Of course, some of these ways include social media as well as you dialing in, because we would like to know what your opinion is on what we're talking about. But not just your opinion, also on what you're thinking if you have any questions. So do the right thing and contact us. Our contact details will be on the screen soon. If you're someone that's on their phone and ready to text away or send your message via social media, on Twitter at SABC Vital Signs and on Facebook, SABC Vital Signs. The show continues after this break. Welcome back to Vital Signs. I'm Dr. Musam Tomben, and today we're talking about donating blood. If this is a topic that interests you, get in touch with us on social media as well as on the phone line, where we'll be having our discussion. Now, receiving blood is one of the most beautiful gifts that you can give to a receiver of blood, and of course, a second chance in life. But did you know that each time you donate blood, you give 3 people the most important gift, which is the gift of life? As the world battles COVID-19 and some provinces in South Africa experiencing the 5th wave of the pandemic, it may lead to more hospitalizations, and of course it is now critical for all of us to donate blood. Zama Buthelezi spoke to Musa Mpore, who is from Soweto in Gauteng, who received an organ as well as blood after she or he was diagnosed with a life-threatening illness at the age of 22. Let's listen to the story.
Musa Mpure is one of many South Africans who were on an organ waiting list after finding himself having an end-stage organ disease that significantly impacted his quality of life. While receiving an organ can become a life-changing event for people like Mpure, not many are lucky to receive organs and blood at their time of need.
It was in 2011 when I was diagnosed with end-stage kidney failure at the age of 23. I knew nothing about it, and I went to the local clinic. They checked me, they checked my blood pressure because I was sick at that time, and they found out that my blood pressure was extremely high. But then they gave me medication and sent me home. So I went home, took medication, and after a while, my illness gotten worse. And then my fiance then, a wife now, said we should go to see a GP. We went to see a GP. And when we go to a GP did a number of tests, which then gave him the idea that he must send me to hospital, and he sent me to Baragwanath Hospital. And when I got to Baragwanath Hospital, the doctors checked me, and this one Indian doctor touched my stomach, and at that time I felt extreme pain. And when I felt extreme pain, I cried immediately because I've never felt that kind of pain before. And that doctor said to me, I think I know what might be the problem. But then he took some bloods and did some extra tests, and he came back and said, you have end-stage kidney failure.
Mpure, then 22 years old, talks to us about the impact of the diagnosis in his life.
The impact was quite enormous, in my life. I mean, it changed everything. I mean, I was young, I was getting ready to go out, party, mingle, and all of that. But I mean, you can imagine being told or being diagnosed with end-stage kidney failure at a young age. It's quite traumatic, So also being told that you're going to be on dialysis and you don't know what dialysis is, and you start, when you do your research, you find out that you have to be in hospital for 3 days in a week, on a machine. You're going to be quite sick for a very long time, You can't eat the food that you've been eating. You can't drink water anymore. So it was quite stressful for me as a young person to know that my life will change. And it really impacted me a lot because I was quite angry. I had depression a lot of times. And it was quite difficult, to live with this disease at that time.
Mpure, like many young people, didn't understand the significance of being an organ and platelet donor.
It was quite difficult when the doctors told me that, in actual fact, for this disease, someone has to donate a kidney for you. Sometimes you see people in hospital, they have broken legs, broken arms, and they get fixed quickly and they go home and everything is back to normal. And when they told me that I have to wait 8 years, 6, maybe 12, or maybe 20 years to receive an organ, I was quite devastated because I thought to myself, who would live on a machine for more than 6 years or 8 years? I thought my life had ended at that time, and I had suicidal thoughts as well, to say, why is it that I must live on a machine? It's quite difficult to even wake up in the morning. I'm always tired. Why am I alive even, But you keep the faith going, and you trust in yourself, and you do as the doctor says you must do,
Mpure talks to us about the day he received a call that would change his life.
Well, that was the most amazing day ever because I've seen people that have been transplanted and how transplant has managed to change or save their lives, And also I've seen the other side of people being on dialysis and dying while being on dialysis, So I was quite excited, scared a bit that I might not maybe come back, but I trusted the process.
Mpure is forever grateful to South African National Blood Services and shares his journey as a platelet recipient.
When I got sick, I knew nothing about blood donation. And when I received blood for the first time, it was when I had the kidney failure. I had no idea that people could donate blood and you could be given someone else's blood to save your life. But when I was doing my research about kidney failure, blood donation, and all of that, I realized it's so important that our people need to donate blood, need to learn why is it important to donate blood and organs, right? We are the one race that is suffering the most, right? That is living with high blood pressure, with diabetes, with kidney failure. I didn't even know that when you donate blood, there are other products that are being taken out of your blood. I mean, I received those platelets because someone donated blood. Someone was brave enough to say, I'm going to take that needle and I'm going to give blood. And the biggest thing is that people say they're afraid of needles. I mean, really, how can you be afraid of needles when you have to be a hero? Heroes are not afraid of anything.
After the break, we'll speak to Dr. Pielo Letola, the lead consultant at donor services at the South African National Blood Services, about blood donation. Signs. Now, every year, organizations all around the globe celebrate World Blood Donor Day, an event that raises awareness about the importance of donating blood and what it means to the health industry, as well as a range of uses and ways in which you could use this blood that a lot of people actually hadn't known about. From plasma treatments to research and emergency use, donating blood has been an important cornerstone that has aided the world on several occasions. Dr. Pielo Letola, the lead consultant at donor services at the South African National Blood Services, talks to us about blood donation. Doc, thank you so much for joining us. Good morning to you.
Good morning, Dr. Musa, and thank you very much for having me here today.
So let's talk about something that's very important. This is the issue of blood donation. That's what the show is all about today. But in your opinion, why is donating blood such a good thing to do?
Well, Dr. Musa, you know, as our previous blood recipient just explained, blood donation really does save lives. On a daily basis, we have thousands of patients that get diagnosed with conditions in hospitals that require blood donation. We have patients, people that get involved in bad accidents, car accidents, etc., on the roads that require blood transfusion. So without any blood donation or without sufficient blood donation from the public in South Africa, then we wouldn't be able to meet that requirement or that demand and be able to treat those conditions which very often are life-saving, are life-threatening.
Now, a lot of the time we'll hear a radio ad or we'll see in a newspaper that, we've got low blood stocks and that people need to go out and donate blood. Can you explain the process of how you get blood to the point of where it's being used and how we get to low blood counts and stocks?
Well, first and foremost, when donors present or any member of the public wants to donate, there's multiple ways they can reach us. They can go onto our website where they can identify the closest clinic that is available to them. They can go to any of our mobile sites. We are present at shopping centers, different malls at any point in time on a daily basis. And once they, or they can even call us on our customer service, on our customer service line, and find out about the closest clinic that they can actually visit. And once they present at any of the clinics, what we do is obviously we go through the processes of just ensuring that all COVID protocol is followed to ensure their safety. Then they go on to then complete a questionnaire, which is a questionnaire intended to establish whether from their own health perspective, are they in a good enough health status to donate blood? Is the blood that they would be donating also going to be safe enough for somebody else to receive? Then they undergo some screening tests. So we check their blood pressure, we check their pulse, we check their hemoglobin. And recently we also introduced a ferritin test, which is a more detailed test for iron. And after that, then they sit on what we call a one-on-one session with one of our nurses so that they can explain to them the process, what it entails, and also to find out if there might be anything that they might have missed when they were filling out the questionnaire, just to make sure that the blood that they donate will be safe for patients and to make sure that the process of donation will be safe for themselves. Once this has happened, they then go on to go ahead and donate. The process really doesn't take long. It takes on average about 20 minutes for the most common blood product that our donors donate, which is whole blood donation. Once they have donated the blood, then our nurses also advise them. We provide some post-donation education, advise them on some precautions to take after donating. So for instance, we don't want, it's best for people to not engage in strenuous exercise, for instance, not to engage in strenuous exercise immediately after donating, to increase their fluid intake after donating, also even before donating, that is also good. Once the blood has been collected from the donor site or the donor center, it is then transported to our testing department at our different testing stations. We conduct testing, for instance, here in Gauteng at Rudiport, which is our headquarters, where our headquarter labs are situated. The blood is tested primarily for infections that can be transmitted in blood. It gets tested for HIV, it gets tested for hepatitis B and C, and for syphilis. Then once the blood has been tested, the blood group has also been ascertained, etc. Then the blood is then stored. One thing I must mention though, for donors who are new donors, who are presenting for the first time, we do require that they come back to donate a second unit before we can actually use some of the components from the first unit. But for donors that are not presenting for the first time, then the blood is then made available to the blood banks. It gets transported to the blood banks. So we have blood banks in different hospitals where the doctors then can be able to access the blood, order the blood for different patients.
Now, a big thing that people who have not donated in the past and, hear of the ads that go out and donate is this issue of payment. Now, one big thing that the South African National Blood Services says emphatically is obviously this on a voluntary basis and no one gets paid to donate blood. But people would argue that you guys sell the blood to hospitals and to people and things such as that. So what goes around the pricing of blood and people not getting paid, or should people be getting paid?
Well, really, it is not payment for the blood. It is really a cost to cover the services. The services involved in collecting the blood from the point when it gets collected at the donor site to the point where it goes to get tested, the transportation to get it to the testing station, the storage of the blood, transportation again to get it to the blood banks, all the electronic systems that we use. So all the processes that are followed require that is basically what the cost associated with a unit of blood is really about. It's not really paying for the blood per se. And yes, in South Africa, we do not pay our donors. It is a completely voluntary process. And there are reasons for this. The reason for this, some of the reasons for this, number one, is that the recommendations from the WHO, for instance, are that donors should actually not be paid to donate blood, that it should not be a process that is incentivized. The reason for this is because if you incentivize the donation of blood, you actually significantly could impact on the safety of that blood that you actually collect. Because what could happen is that, let's say, for instance, a potential donor wants to come and donate, but they know that they have been involved in certain maybe risky lifestyle behavior that could impact, that potentially, let's say, for instance, could have exposed them to a condition such as HIV, which can be transmitted in blood. If we incentivize blood and let's say we start paying people to donate blood, then people might want to come and donate because they need the incentives. That is the primary reason why the process of blood donation really is voluntary. It's one of the key measures through which we ensure the safety of the blood. And then I must also mention also with regard to the cost, a huge cost driver for the price or the price attached to a unit of blood really is the testing, because South Africa conducts state of world-class type of testing. It is called ID-NET testing, which is individual donor nucleic acid testing. It's a form of PCR testing that we conduct on every single unit of blood that is donated. This is very expensive testing that we do, which actually ensures that our blood is very safe. It's a type of testing that you generally find in first world countries.
So let's look at where South Africa currently stands with respect to blood donation. Like I mentioned a little bit earlier on, the issue of, having low stocks in terms of blood available, especially during peak seasons like December and Easter and times like that where, there are blood or blood products that are needed. Where are we standing with respect to the different provinces? Are certain provinces okay with respect to their blood stocks? Are other provinces really struggling with getting donations in?
Well, the provinces differ, as you rightfully said, Dr. Musa. Unfortunately, the provinces differ, and this has become especially more so following the, the occurrence of the COVID-19 pandemic in the country. So we have seen COVID-19 has had quite a bit of an impact on how we collect blood, how donors present at our donor centers to donate. And what we have seen in certain places is that some provinces have been more affected than others. So just to share with you, for instance, KwaZulu-Natal has been one of the provinces where we've really been struggling recently with our blood collections. And that also has something to do with the fact that we used to collect quite a good percentage of blood in KwaZulu-Natal. So the provinces get impacted depending on where we were collecting the blood to start with. So looking at KwaZulu-Natal, for instance, we were collecting a lot of the blood in KwaZulu-Natal from schools, but there's been quite a bit of reluctance in some of the schools to reintroduce the process of blood donation for scholars, and mostly related to concerns coming from schools with regard to safety for the scholars. So those provinces, for instance, have not really been able to really pick up and get back to where they are. But when we look at Gauteng, for instance, it has been a whole lot better. than it has been when you compare with provinces such as KwaZulu-Natal. But even in Gauteng, we're really not where we used to be prior to the COVID pandemic. We're still struggling quite a bit, and that is why we've been present on the media quite a bit with call outs on the public to say, please do come through and donate, because what we have been experiencing is changes due to COVID pandemic with regard to donor patterns presenting at donation sites.
Please go out and donate. That's our message for the day. And of course, that is from the National South African Blood Services. We continue the discussion with Dr. Pirlo about what you could do if you want to go out and donate blood. Donating and getting you out to do the right thing. We continue this discussion after the break. Welcome back to Vital Signs. I'm Dr. Musamtombe, and I'm trying to sikhuluma ngendaba zegazi. Sikhuluma ngokudonate and all that you could do to get the count, and that, of course, is the number of blood available in the country back up to where it used to be. Now, despite the life-saving properties of blood donation, it benefits over 800,000 people annually. Very few people are regular blood donors. Now, you need to be between the ages of 16 to 75 in order to donate blood. However, the 40 to 49-year age group donates the highest percentage of units. Let's listen to two stories of two donors who spoke to Retabile Tsimakwane.
My name is Zandile Ndlovu. I'm 52 years old. I'm here to donate. I started donating when I was still young, when I was in matric. This is my 58 times donate. And then the reason why I'm donating, I didn't know my group type until my first donation, whereby they told me that it's blood 0+, which is blood O. O, that means it's a needed blood that saves lives. So since then, I've been donating to save life, because you will never know. One day you'll be involved in an accident, and the blood O is the one that is needed. Somebody is waiting there for your blood. So I'm encouraging everybody, especially the youth, to come and donate to save lives. I donated because, not to say I need free gifts. No, it's not for that. It's to save life.
My name is Sharon. I'm 48 years old. I was involved in an accident in 1991 in which I lost my brother and my best friend. I also needed a blood transfusion. So when I left school, I joined the police. And ever since I was in the police, I started donating. I'm now today on my 65th donation. I stopped donating blood about 3 months ago, and to which I started donating platelets, because platelets also saves lives for cancer patients as well. So I've donated blood, and I would like to ensure you, to save a life, please to start donating.
Now, according to the South African National Blood Services, less than 1% of South Africans are active blood donors. As we're celebrating Youth Month this month, there's an urgent need to also create awareness amongst young people to donate blood. And as this noble act, you can go out and save lives. Now, we continue our discussion with Dr. Pirlo Letola, the lead consultant at donor services at the South African National Blood Services, to find out more about the importance and benefits of donating blood, especially to you as a young person. Doc, welcome back. I think let's continue our conversation. What you started off earlier on by doing is really describing what happens and how we get to a pack of blood that someone in need of it would receive it. But there are just a few things I want to look at. This is the issue of the questionnaire that is filled out. What exactly is being asked in this questionnaire? And of course, there are obvious things that would be there, I'm assuming, such as health, history, and things such as that. But what important thing is there that a lot of people need to be aware of if they're thinking of going out to donate blood?
Well, the questionnaire, the questionnaire that is filled, Dr. Musa, before blood donation, overall is the questions are on it's health-related questions pertaining to whether one has been is in general still healthy state of being. Also questions related to whether they might have any underlying medical conditions that would make it unsafe for them to donate, or whether they might have been exposed to any medical or any condition or any situation that could actually result in their blood not being safe for somebody else to receive. We also have questions related to travel because there's considerations such as, for instance, malaria. So there are questions related to whether one could have traveled, let's say, for instance, to a malaria area, because for people that don't live in malaria area, if they receive blood, for instance, from a person that lives in a malaria area, there are instances where there can be transmission of malaria, even though the donor themselves might have not had any symptoms or displayed any symptoms or felt any symptoms of a malaria. So the questions in a nutshell are health questions as well as lifestyle questions.
Now, earlier on, you addressed the issue of scholars. These are kids that go to high school that you've previously had access to in terms of getting them to donate blood. So for young people, what is the criteria needed in order to donate blood? What do you need to meet?
For young people, the criteria is identical to everyone else. So they need to be of age 16 or above. They need to just generally be in good health and generally lead also safe sexual lifestyle. So safe sexual lifestyle is one of the considerations that one would have to make before they actually present to donate. But what we do encourage is do present, come to our sites and find out, because when we say safe sexual lifestyles, there's different definitions on how this works and what we encourage. But generally, one should be living a safe sexual lifestyle.
Mm-hmm. Now, what makes one eligible to getting or donating blood? What are the criteria you look for there?
So in order to donate blood, you also need to be of a certain age. So you need to weigh at least 50 kilograms if you are going to donate whole blood, or a minimum of 55 kilograms if you are going to donate, if you are going to donate whole blood, you need to weigh 50 kilograms. If you are going to donate platelets, for instance, you need to weigh at least 55 kilograms. On the day of donation, also, we do encourage that you try and increase your fluid intake. If possible, do take a snack before you come through to donate. But if you haven't had a snack, we can provide you one just before you donate.
Are there conditions that preclude one from donating? For instance, if you are pregnant, can you donate blood?
Well, no, you cannot donate blood if you are pregnant. You cannot donate blood if you have medical conditions such as hepatitis, if you have medical conditions such as syphilis. If you are living with HIV, you cannot donate blood. However, you can donate blood if you have a condition such as hypertension, or if you have a condition such as diabetes, provided that medical condition is well controlled. So those conditions that, or let me say infections that can be transmitted in the blood are the ones that would preclude one from donating blood. Secondly, any medical condition that would place the donor themselves at risk would also preclude them from donating blood.
Now, a lot of people that want to go donate blood and end up being rejected, who are over the weight of maybe 50 kilograms, complain of this issue of anemia, that they were told that they're anemic, so they can't donate blood. Take us through anemia and why it's so important to be aware of your state.
Well, anemia basically means that the donor doesn't have sufficient iron in their blood. And iron is a major component of red blood cells. And red blood cells, on the other hand, are a major component of whole blood, which is one of the most common products that we collect. Now, in some instances, a donor might already be aware that they have anemia because they have visited their doctor or their GP and been informed that they don't have sufficient iron. But many a times, people walk around with low iron in their blood without necessarily being aware of it, because they might not be aware, because they might not have significant symptoms as yet, because there are stages which lead to anemia. First and foremost, when one doesn't have sufficient iron, they start off by developing what we call iron deficiency. At that point, if they were to get tested, they would be found to have insufficient iron. However, they would not at that particular stage be having any signs or symptoms or feeling anything untoward in their body. At that point, when they have iron deficiency, if they don't get sufficient iron, either through treatment like iron supplementation, iron tablets, or even through good diet rich in iron, if they don't get sufficient iron to replace whatever, to replace that iron, then they would eventually develop anemia. Conversely, people can also have anemia, not because they don't have sufficient iron or they're not taking enough iron, but they could also have insufficient iron because they have an underlying medical condition that is actually leading to them losing their iron faster than they are able to take it in. So once the iron reaches a certain threshold, so the levels of iron continue to drop. If they continue to drop beyond a certain level, then they develop what is called anemia. And basically what it means is that now they have symptoms of the low iron. Now they have, for instance, those symptoms would be things such as tiredness. It would be things such as some people get cravings called pica, where they start having cravings for things like ice, where they get, some people even take soil as one of the, due to the cravings. They might also have a poor concentration, realized poor concentration. It could affect different aspects of their body, their bodily function. And at that point in time now, they now have full-blown anemia. Many a times when people come through to donate, people who come to donate usually are people that are not feeling sick at that particular time. So they would not be at that stage of anemia as yet if their iron is low. So some of them would be having iron deficiency, which often then only gets picked up when they come at the donor site, because as I mentioned earlier, one of the screening tests that we do before people can donate is we check for their hemoglobin. So during that checking for hemoglobin, that's when we would realize that they don't have sufficient iron, so they are already iron deficient.
Okay, we have a caller. Sorry to interject. We've got Jabulile from Mafikeng who's got a question. Jabulile, good day. Jabulile seems to have disappeared, but the question was around access to the blood donation facilities. That I think they say they're from Mafikeng, but they have difficulty accessing facilities to donate blood. So do we have nationally enough places for people to go out and donate blood?
Oh, yes, absolutely. We do have quite a wide footprint across the country, Dr. Musa. And as I mentioned earlier on, so there's multiple ways in which they can actually reach us. One of the ways in which they can reach us is they can visit our website, www.sanbs.org.za. And on our website, we actually have a map. On the map, you can place in you can enter the address, your physical address, and our system will then give you information, will tell you which donation site is closest to where you are. Alternatively, they can also reach us on different social media platforms. They can also call us directly at our customer service center, and our number is 0800 119 031, where they can reach us and find out about any site where they can actually go and donate.
Well, thanks for that one. We continue our discussion around blood donation, of course, as we go to an ad break. That is Dr. Pirlo looking at where you can get your blood donated, and of course, all the questions that you might have around blood donation. We'll see you after this ad break. Welcome back to Vital Signs. Now, as we commemorate Youth Month, we put the spotlight on youth and blood donation. Now, according to South African National Blood Services, most young people don't have chronic diseases, and the SANBS urges them to donate blood. Now, because of the pandemic, some people have been hesitant to donate blood, and the SANBS is still focused on its communication and message to say that it is safe to do so. Now, the dangerously low blood supply levels have forced some hospitals to defer patients from major surgery, including organ transplantation. Rethabile Tamikwane spoke to young people about the importance of blood donation and if they're donating or planning to donate blood anytime soon. Let's take a listen.
Donating blood is important because it helps a lot of people out there. So I haven't donated the blood, but that was because they told me that my weight doesn't allow me to. And unfortunately, I don't know my blood test, my blood group.
I'm not donating blood, but I am interested in donating, and I don't know my blood type, so I see it very important because many people get injured in many ways. Yeah, so some they really need blood, so it's important because it's saving lives.
I haven't donated blood yet, and I don't know my blood type, but I think it's important to donate blood to save lives of people, because there are people who need blood and those that are injured. So donating blood is important to save lives.
I do not donate blood. I've never, but I wanna try donating blood, but I don't know where. I don't know my blood type, but I know the importance of donating blood because it saves other people's lives.
I've never donated blood before. I don't know even my blood type, what it is. But I think donating blood is a good thing because like it's sort of like helping others, as some people say, it's like we rise by lifting others, of which is a very good thing, because maybe if you're donating blood today, maybe like in coming future, it might help you too.
I think it is important for young people to donate blood because it saves lives, and we're not sick. We don't have any sicknesses, and I've donated blood before because it also helps around the family.
I've never donated blood and I don't know my blood type, but I think it is important for young people to donate blood to help other people who are sick, some are injured during accidents and so forth.
We continue our discussion with Dr. Pielo Letola, the lead consultant at donor services at the South African National Blood Services. And of course, as you saw in the insert, a lot of young people giving their opinions on, why it's so important to donate blood, but a lot of them actually not having had that experience of donating blood. So what awareness sort of initiatives is the SANBS putting out to get young people to go out and donate blood?
Well, Dr. Musa, we constantly carry out different initiatives and campaigns which are intended to raise awareness with the general public, regardless of age, to try and educate on the importance of blood donation, but also to raise awareness on the significance of blood donation. We also have school education programs that we conduct. We have donor educators that visit schools to educate scholars on why it's important to donate blood, what does it entail, and also to address some of the myths that are often associated with blood donation. And also, as you know, for the youth, one area really that the youth are very active on is social media platforms. So we have awareness campaigns that we post on our different social media platforms where we feel that this is one of the areas where we are more likely to reach the youth in terms of messages related to blood donation. At the moment, just to share with you, we are working on a couple of campaigns actually that are related to the youth, which are actually specific for the youth, where we are tailoring messages and tailoring delivery and the awareness, tailoring it to the sort of information and sort of messages that we feel will really resonate with the youth more than our general messaging that we often send out on different platforms. We're also going to be conducting some activations at the schools related to this, just to raise awareness on the importance of blood donation and also address some of the myths, because for some of the youth, the reason why they do not donate is sometimes because some of them have been misinformed with regard to whether blood donation is something that would be safe for them to take part in. So through these awareness campaigns, our plan is really to reach as many of the youth as possible, and hopefully get them interested and invested in this activity. And while blood donation is very good and it saves lives, it's also good for the youth, because what we have found and has been documented in studies is that blood donors generally do tend to live healthier lifestyles. I think that that whole emphasis on, for instance, things such as you need to lead a safe sexual lifestyle, etc., often really sensitizes people on the importance of, leading safe sexual lifestyles, etc., eating healthier, practicing healthier lifestyles. And it's been found, really proven in studies, that blood donation does have this positive impact. And this is something that we also really would like to see amongst our youth as a practice, and something that they can also, incorporate in their lifestyles. And then last but not least, one of the other key reasons why we really do need the youth to come forward and donate is that a good percentage of our donors are as you mentioned, the largest proportion of our donors are between the ages of 40 to 49 and then above as well. And what one always gets concerned about is that as time goes on, obviously those donors, as they age, will not be able to donate, or might not be available to donate as much as they are at the moment. So we do need to always make sure that we get youth also getting used to the practice of donation, so that when our older donors can no longer donate, this process, the practice can still be sustained.
Regular blood donation, that is what we're looking for. We've got Patricia from Brits with a question. Good day, Patricia.
Good day, how are you?
Very well,
and
how are you?
For giving me the opportunity.
What's your question?
Hello?
Yes, what is your question, ma'am?
Okay, I'm a blood donor. I think I started some few years ago because of, in 2011 my son was in an accident and then he needed blood. They donated. I think that's something that made me to be interested on donating blood. And then I think because of we don't have more information about that and all that. But now I've been having a problem of breathing within myself. So I want to find out firstly is it important for now to donate, or should I wait a little bit? And secondly, I think last year when I donated, I felt dizzy and all that. So I want to find out what causes that. Because every time after I donate, I have to relax and then just to stay maybe 30 minutes before I can stand up. Because if I stand up, I end up being dizzy. And then the other one, I've got a friend, I've been motivating him to donate, but he had this information that he had somebody who was working at the blood donor, whatever. She told him that I think people, they've got wrong information again. They said that when black people donate, they throw their blood away, they don't use it.
Oh my.
So
All right.
I think those are the kind of the things that they need to be assured that that thing is not happening.
For
and
sure.
all that.
Thank you, Patricia, for all those questions. We'll get them answered now. So, Dr. Pierlo, very simple questions, really. The one is the issue of benefits, or I guess the risks or side effects that come with donating blood. And then, of course, should you go out and donate blood if you're acutely ill? And then, of course, the idea of misinformation, all the rumors people heard, all the lies people get told that get spread across in terms of fake news.
Yes, Dr. Musa, I just want to say that, yes, unfortunately, there is a lot of misinformation out there that can spread. So starting with the issue of a side effect after donation, yes, blood donation can result in side effects sometimes in some instances. Just to mention to you that there can be what we call localized side effects, where one, for instance, can get maybe a bit of bruising on the arm where the needle was inserted, or they might get, for instance, a hematoma which would be a bit of swelling with discoloration and sometimes a bit of pain as well at the point where the needle was inserted. Usually this resolves within a couple of days. Sometimes just a mild gel applied on the area is sufficient to address that particular problem. But there's also side effects that we call generalized side effects of blood donation. And this mostly is feeling lightheaded after blood donation. And the reason why one would feel lightheaded after blood donation is because we take about 500 mils of the blood, about 450 mils actually on standard of blood when one comes to donate. And sometimes the body needs a little bit of time to recover and also to kind of restabilize itself. This is the reason why, wherever possible, we do encourage our donors, wherever possible, that after they donate, that they can sit, even if it's just for about 15 to 20 minutes. It really does make a big difference with regard to the risk or possibility of developing lightheadedness, that they just sit. This allows the blood pressure to go back to normal, because what we often see is that the blood pressure does drop a little bit, quite a bit for some donors, and a little bit for some, but a little bit more for others. And so that process of resting after donation assists the body to then recover and the blood pressure to kind of restabilize and go back to normal and reduce that risk of things. But yes, as the lady who called earlier, as she alluded, it can happen that she can feel a bit lightheaded. Another thing that we do recommend is before donation, just to make sure that you take as much fluids as possible.
Yes.
Taking salty snacks also helps with blood pressure. So taking salty snacks or taking fluids, immediately after blood donation does also help with reducing that risk of feeling lightheaded.
Yes, Doc. So very quickly
Now,
before
I
you
must
go,
also just-
we've run out of time, unfortunately, but one question I'm sure a lot of people have at home is, can you donate blood if you've gotten a COVID-19 jab or any vaccine? Yes or
Yes,
no?
you can donate blood if you have had a COVID-19 vaccine. You
Yes.
can even donate the following day. You can come through to donate. As long as you are feeling well,
Yeah.
you are more than welcome to donate. But
Thank
if you
you.
are not feeling well, just wait until whatever discomfort you are experiencing, whether
Yes.
it's a rash or lightheadedness, headache, whatever,
Okay.
once it has resolved, you are more than welcome.
Thank you so much, Doc. Sorry to cut you off there. We are out of time, but it has been an awesome show, really discussing the benefits of going out to donate blood and why you need to go out and do the right thing. Now, importantly, stay away from misinformation, because all the truth has been outlined to you throughout the show. Go out, donate blood, and really go out and save more than one life. From us here at the Vital Signs team, thank you so much for joining us. I'm Dr. Musa Mtombeni. We'll see you soon.